Hello, I am Dr. Sudhir Reddy. These videos are information series for patient education so that patients become an informed patients aware of their condition so that they are not taken for a ride or they are not misled by people. Do you want to know if you have arthritis in your knees? It is a very common question for everybody because arthritis is a very common condition and there's millions and millions of patients in India and everywhere in the world suffering with arthritis. But at the same time, we do see a lot of patients who do not have significant arthritis, but they are under the impression that they have arthritis. They are taking a lot of medications, unnecessary treatment. Sometimes they are actually undergoing unnecessary surgeries, believing that they have severe arthritis of the knee. So, what I want to do is, I want to educate you to make you an informed patient so that you are able to make out whether you have arthritis or not. If arthritis is there, how bad is it? How severe is it? Is it bad enough to require a surgery? Is it bad enough to require injections or various medication? Or if it is mild? This is the information I want to give you in the video today. Okay? So, I'll tell you what arthritis is. In any knee joint, any joint is basically between the two bones. Moving part between the two bones is called joint. Okay, so this is the thigh bone, this is the leg bone. The ends of both, they have to bend at the knee. They are like this. They have to bend. The knee has to bend. So, for the friction to come down, for the movement to be painless, the ends of the joints are covered with the material called cartilage. Cartilage is a very soft material, somewhat cushiony material, so that when you move, the movement is very smooth and it does not make any sound and it does not cause any pain. It is a protective layer in the joint. So, what is an arthritis? When the cartilage starts getting damaged, either because of wear and tear or because of an injury or any other disease, when the cartilage gets damaged, it is called arthritis. There are different types of arthritis. We are not going to speak about all of them. We will speak mainly about osteoarthritis, which is 98% of the arthritis cases. So, osteoarthritis is the most common condition. So, most people suffer with osteoarthritis only. So, I am going to speak about that. So, in osteoarthritis, the wear and tear is very gradual. You start losing the cartilage gradually. So, initially there may be very little pain, but as the osteoarthritis progresses and becomes severe, you will start feeling more and more pain, and eventually you may reach a stage where you may not be able to walk. So, but there are many other conditions which cause knee pain without osteoarthritis also, and many patients are told they have severe arthritis and they undergo lots of treatment. Many of them are unnecessary. Some of them actually undergo major surgeries without actually needing them. So, I want to give you an information so that you can make out whether you have an arthritis or not. The common question of the people who come to me is, oh, the gap has come. Gap has come, that means I have arthritis. That is completely wrong. Okay, I'll tell you why. Cartilage is not like bone, it is like muscle. So, in the X-ray it is not seen. So, if you have cartilage in the joint, you do not see the cartilage in the X-ray, you only see the upper bone, lower bone. So, you see the gap in which place the cartilage is there. So, you see actually a gap between the two bones. That means that gap is filled with cartilage and you do have cartilage. The wider the gap, the more amount of the cartilage that is there. So, if you see gap that is normal, it is good. If the gap is coming down, that means knee cartilage is wearing off, cartilage is becoming thinner and thinner, and if there is no gap, that means there is a severe arthritis, which means bone and bone are touching each other. Okay, so I will this goes through various stages: stage 1, stage 2, stage 3, stage 4. I'll explain you what it is. I'll explain you how a normal knee looks and how an arthritic knee looks like. Okay. So, in fact, in this model also you can see this is a normal knee with a good amount of cartilage. So, this is what we call moderate arthritis, where there is a significant arthritis on both sides on both the thigh bone and leg bone, but still some amount of cartilage is left. Then you see what we call a severe arthritis of the knee, where cartilage is completely gone. There is no cartilage between the bones. Bone and bone are rubbing against each other. And also, as there is a wear and tear and arthritis, the bone tries to react around it. So the bone around the joint tries to throw up more new bone in an irregular form. These are called osteophytes. So if you see an excessive bony growth towards the margins of the joint, that means it is a bone's attempt to repair. That means arthritis is there, significant arthritis is there. Okay, I'll show you on the X-ray now. Okay. So I want to show you what a normal knee looks like first. This is your thigh bone, this is your leg bone. You see the gap. You see the gap. That gap is not an empty space. That gap is filled with cartilage. So in a good knee, you will see good amount of gap, and as you can see, the edges of the bones are very smooth and they roll on each other. So it is a good knee. When you develop arthritis, you can see in this picture here, you can see that the gap has come down. In fact, the bone and bone are touching each other. There is actually a slight bend also in the knee. Okay, and you can see there is an excessive bone growth here, irregular bone growth here. The bone has become irregular here. So overall, the knee has become quite rough, quite irregular. The gap is gone. There is an excessive bone. This is called arthritis of the knee. Okay, so now you can make out whether you have an arthritis of the knee or not, because a normal knee look like this. A arthritic knee will look without any gap and with excessive bone at the corners. Okay, I will also show you how a severe arthritis looks like, or I will show you different grades of arthritis. So this picture is just to show, give you an idea. You don't need to really know this much. This is a normal knee where the gap is good. It's a mild arthritis where slight irregularity, slight reduction of gap. So this is a normal knee where the gap is good, the ends are regular and smooth. This is an early arthritis where you can see a slight reduction in gap and it has become a little bit irregular. This is what we called grade 2, where there is more than 50% of loss of space, more than 50% reduction in the cartilage, 50% reduction in the space on the X-ray. You see that still some gap is left. That means still some cartilage is left, but a lot of it is gone. That is called stage 2. This is called stage 3, where there is no cartilage left. Okay, bone and bone are touching each other. All the cartilage is gone. That is called stage 3. I will also show you stage 4. Stage 4 is where the cartilage is completely gone, no gap is left. At the same time, because the secondary effects are taking place, because the bone is bent, the bone is getting crushed here and the bone is sliding away. There is a lot of deformity and the bone is moving away from underneath the other bone. So these are secondary effects. So this is when you call it stage 4. Okay. So now you know how to identify whether you have arthritis or not, and also you can also make out how severe it is and what grade it is. So if you have this knowledge, if someone tries to mislead you that you have severe arthritis or you need surgery, you can question. There does appear to be some gap, there does appear to be some cartilage left. Do I really need such treatment? So my purpose is to empower you to become an informed patient so that you have a control over your health. Thank you.